Hello and welcome to our webinar on alcohol misuse screening and counseling. My name is Jennifer Boniface and I am one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on the clinical aspects for the Medicare preventive services of alcohol misuse screening and the subsequent counseling following a positive alcohol misuse screen. April is Alcohol Awareness Month. Alcohol misuse and screening and counseling is covered as part of the preventive services benefits for Medicare Part B. Screening and counseling can play a crucial role in detecting, addressing, and treating alcohol misuse before it progresses into alcohol dependence in patients. Our objective for today is to provide an overview of the Medicare preventive services for alcohol misuse screening and counseling. And we will cover background information on alcohol misuse, an overview of the Medicare preventive services for alcohol misuse screening and counseling, and the Medicare Part B coverage criteria for these preventive services. We'll begin with a few facts about alcohol misuse. Alcohol continues to be the most commonly used addictive substance in the United States, and alcohol misuse remains one of the leading causes of preventable death in our nation. According to both the CDC and the National Institute on Alcohol Abuse and Alcoholism, each year excessive drinking claims the life of approximately 178,000 Americans. And to put that into perspective, that's about 385 preventable deaths every single day. Alcohol doesn't just take lives, it also shortens them. The CDC reports that people who die from excessive alcohol use lose an average of 24 years from their expected lifespan. Beyond that, alcohol misuse is linked to more than 200 diseases and injury-related conditions, from liver disease to cancers of the mouth, esophagus, pharynx, larynx, liver, and breast. And I do see a question in the chat right off the bat from Diane, and I will be addressing it. It's asking about if you do the screening and they don't drink, if you can still bill that screening. And I am going to address that in a little bit, so we will get to your question. But that is an excellent question. Okay, one of the most common and most concerning behaviors related to alcohol misuse is binge drinking. More than 38 million adults in the United States engage in this type of drinking. The National Institute of Alcohol Abuse and Alcoholism defines binge drinking as drinking enough alcohol in a short period of time to raise the blood alcohol levels to 0.8% or higher. And for most adults, that usually means having 5 or more drinks for men or 4 more drinks for women within about 2 hours. Per the CDC, screening for alcohol misuse and offering brief counseling can potentially decrease episodic drinking by 25% among individuals with excessive alcohol consumption. So let's take a moment to review a few definitions to gain a clearer understanding of topics related to alcohol use. And we'll start with alcohol dependence. Alcohol dependence refers to the condition where a person develops a strong need or craving for alcohol. Per MLN 9560465 Substance Use Screening and Treatment, a patient is considered alcohol dependent if they display at least 3 of the following criteria: tolerance, withdrawal symptoms, impaired control, preoccupation with acquiring or using alcohol, persistent desire or unsuccessful efforts to quit, sustained social, occupational, or recreational disability, or continued use despite negative consequences. So now that we've discussed alcohol dependence, let's move on to alcohol misuse. Alcohol misuse refers to drinking patterns that are considered unhealthy yet still fall short of meeting the clinical criteria for alcohol dependency. According to the National Institute on Alcohol Abuse and Alcoholism, alcohol misuse refers to drinking patterns that increase the risk of harm to an individual or others. And this can involve how much a person drinks, how often they drink, or the situations in which drinking occurs. And it includes behaviors such as binge drinking and heavy alcohol use. For reference, a standard drink in the United States contains 0.6 ounces of pure alcohol. So in other words, a standard drink is equivalent to a 12-ounce beer, 5 ounces of wine, or 1.5 ounces of 80 proof liquor. And the updated U.S. dietary guidelines for Americans recommend limiting alcohol consumption. Now that we've reviewed definitions for both alcohol dependence and alcohol misuse, let's move on and look at some short-term and long-term health effects from alcohol misuse. Short-term health effects of alcohol misuse may include injuries such as motor vehicle accidents, falls, burns, and drownings. It can also contribute to acts of violence, including homicide, suicide, sexual assault, and domestic abuse. Other short-term effects include alcohol poisoning and risky sexual behaviors. In pregnant women, alcohol use can harm the unborn child, leading to miscarriage, stillborn, or fetal alcohol spectrum disorders. Long-term health effects can be even more serious. These include cardiovascular and neurological conditions such as hypertension, heart disease, stroke, and dementia. Alcohol misuse is also linked to gastrointestinal issues like liver disease, pancreatitis, and other digestive disorders. It increases the risk of several types of cancer, including cancers of the mouth, throat, esophagus, larynx, breast, liver, colon, and rectum. In addition, it can contribute to mental health conditions such as depression and anxiety and weaken the immune system, increasing the risk of infection. For babies exposed to alcohol during pregnancy, long-term residual effects may include fetal alcohol spectrum disorders. The alcohol misuse screening assists both the patient and the healthcare provider with identifying potential alcohol misuse. CMS does not recommend specific alcohol misuse screening tools. Instead, the choice of a particular tool is left up to the judgment of the healthcare provider in the primary care setting. Providers should document in the medical record that the patient screens positive for misuse, but their levels or patterns of consumption do not meet the criteria for alcohol dependence. Additional documentation for alcohol misuse screening should include date the service was provided, office visit notes for date of service, and screening test results and documentation of any follow-up care or counseling that was given following evaluation of results. All documentation should be dated and signed with the provider's credentials. After completing the alcohol misuse screening, if alcohol misuse has been identified, the patient is then eligible for counseling. The purpose of counseling is to assist the patient with addressing and managing the behaviors associated with alcohol misuse, with the eventual goal of treating them. Behavioral counseling interventions should align with the 5 A's approach endorsed by the U.S. Preventive Services Task Force, and I'm going to briefly review those 5 A's. A link to the U.S. PSTF's Behavioral Counseling Interventions and Evidence-Based Approach is included on this slide if you'd like to read more about the 5 A's approach or get additional details on each of them. And the information on those 5 A's is located halfway down on the page. So the 5 A's approach consists of assess, ask about, assess behavioral health risks and factors affecting choice of behavior change goals and methods, advise, give clear, specific, and personalized behavior change advice, including information about personal health harms and benefits, agree, collaboratively select appropriate treatment goals and methods based on the patient's interest in and willingness to change the behavior, assist, using behavior change techniques such as self-help and/or counseling, aid the patient in achieving agreed-upon goals by acquiring the skills, confidence, and social and environmental supports for behavior change, supplemented by adjunctive medical treatment when appropriate, and arrange, schedule follow-up contacts, in person or by telephone, to provide ongoing assistance and support, and to adjust the treatment plan as needed, including referral to more intensive or specialized treatment. Documentation for behavioral counseling should include the date the service was provided, office visit notes for the date of service, and documentation of the counseling intervention was provided by a physician or qualified non-physician practitioner in a primary care setting, as is consistent with the USPSTF's 5 A's approach of assess, advise, agree, assist, and arrange. And again, all documentation should be dated and signed with the provider's credentials. And we're going to go over that a little bit more when we talk about the billing and coding later on in the webinar. Including, we'll answer that question, Diane, when we go over coding. Prior to completion of alcohol misuse screening and counseling, ensure the patient meets the eligibility and frequency criteria for these services. You can find additional information on alcohol misuse screening and behavioral counseling in the National Coverage Determination 210.8 Screening and Behavioral Counseling Interventions in Primary Care to Reduce Alcohol Misuse. So now let's take a look at some of the screening and counseling resources available to address alcohol misuse. Remember, CMS does not suggest any tool as the preferred tool, but rather allows the healthcare provider in the primary care setting to determine which one would be best suited to meet the patient's needs. And we're going to discuss one of the more commonly used tools, the Alcohol Use Disorder Identification Test, or audit. Audit is designed to assess an individual's alcohol consumption and its potential residual effects on their health and well-being. It can be administered either electronically or on paper. For the paper version, the patient may complete it independently, or a healthcare provider can conduct it as an interview and record the patient's responses. And at the bottom of the slide, you can see some examples of the audit screening tool. The audit tool on the left is the paper version, and the audit tool on the right is the electronic version. For the paper version, the healthcare provider tallies up the numbers from the individual boxes to get a score for this screening. The electronic version automatically tallies it up once the user submits it. After analyzing the total score, the healthcare provider can then determine if the patient has a positive result on the audit screening and whether further interventions such as counseling should be implemented. The audit scores range from 0 to 40. A score of 0 to 7 indicates low-risk drinking. A score of 8 to 14 indicates hazardous or harmful alcohol consumption. And a score of 15 or more indicates the likelihood of alcohol dependence or moderately severe alcohol use disorder. And I've included links to both the electronic and paper versions of the audit screening tool on the bottom of the slide. And please note that there are multiple versions of this tool available for use. The CDC developed a guide to help healthcare providers and organizations understand and implement screening and brief intervention programs for individuals engaged in risky alcohol use. It offers detailed guidance on how to screen patients for alcohol misuse, along with strategies for delivering both brief interventions designed to reduce risky drinking behaviors. It also includes additional resources. For example, Appendix O outlines guidance on training for delivering brief interventions. The training uses 4 key categories: confidence or self-efficacy, style, content, and practice. Appendix Q provides information on billing and coding for these services, along with links to resources from CMS. And a link to CDC's Planning and Implementing Screening and Brief Intervention for Risky Alcohol Use is included on the slide for you to review. When planning care and treatment, there are several valuable resources available to assist both patients and healthcare providers. Individuals facing a mental health or substance abuse emergency, including thoughts of suicide, can access free, confidential support 24 hours a day, 7 days a week by calling 988 or visiting 988lifeline.org. Additional tools and information are available through the SAMHSA 988 Partner Toolkit. To further support individuals in crisis, CMS has identified 2 key services. The first is the Safety Planning Interventions HCPCS code G0560. This service helps patients develop a personalized plan to stay safe, particularly those at risk for suicide, self-harm, or high-risk substance use. It focuses on recognizing warning signs, building coping strategies, and connecting individuals with supportive resources to improve both immediate and long-term safety. The second is the Follow-up Contact Intervention HCPCS code G0544. This service provides continued support following discharge from a crisis event, including up to 4 phone check-ins each month to help individuals stay connected to care. In addition, you can find more guidance and resources on the National Institute on Alcohol Abuse and Alcoholism's website under Screen and Assess, Use Quick, Effective Methods. It offers evidence-based approaches and provides comprehensive guidance and practical tips to help healthcare providers deliver effective, compassionate care. Now that we've covered what alcohol misuse screening and counseling services are, let's go over the Medicare coverage criteria. Medicare covers 1 alcohol misuse screening annually for all Medicare Part B beneficiaries. This includes pregnant patients as well. If the screening is positive for alcohol misuse, the patient would then be eligible for up to 4 face-to-face counseling sessions per year, as long as the following criteria are met. The patient misuses alcohol, however, the levels or patterns of consumption do not meet the criteria for alcohol dependence. the patient is competent and alert during counseling, and the counseling is provided in a primary care setting by a qualified primary care provider or the other primary care practitioner. Per CMS, a primary care setting is defined as a place where clinicians deliver integrated, accessible healthcare services and are responsible for addressing most patient healthcare needs, developing a sustained patient partnership, and practicing in the context of family and community. CMS further clarifies that they exclude emergency departments, inpatient hospital settings, ambulatory surgical settings, independent diagnostic testing facilities, skilled nursing facilities, inpatient rehabilitation facilities, and hospices from the category of primary care setting. Per NCD 210.8, a qualified primary care physician is defined as a physician who is identified in the available data as a general practitioner, family practice practitioner, general internist, or obstetrician or gynecologist. A primary care practitioner is defined as a physician with a primary specialty designation of family practice, general practice, geriatric medicine, internal medicine, obstetrics or gynecology, or pediatric medicine, as well as non-physician practitioners such as certified clinical nurse specialists, certified nurse midwives, nurse practitioners, and physician assistants. The alcohol misuse screening and brief intervention service can be provided as part of Medicare's preventive service benefits, as well as part of the initial preventive physical exam and annual wellness visit. Providers should limit counseling sessions to one intervention per day for each patient. There is no copayment, coinsurance, or deductible for alcohol misuse screening and counseling if the healthcare provider accepts assignment. Both services are telehealth eligible. The requirement can be met through audio-only interaction. According to telehealth.hhs.gov, Medicare has temporarily waived the in-person visit requirement both within 6 months of the initial Medicare behavioral or mental health telehealth service and annually after that through December 31st, 2027. These telehealth flexibilities also extend to rural health clinics and federally qualified health centers. Now let's address coverage of these preventive services in the rural health clinics and federally qualified health centers. Per the Medicare Benefit Policy Manual, Chapter 13, Section 50.1 and Section 50.2, Medicare covers preventive services recommended by the U.S. Preventive Services Task Force with a grade of A or B as appropriate for the individual. The U.S. Preventive Services Task Force has assigned a grade of B to screening and behavioral counseling interventions for unhealthy alcohol use in adults 18 and older, including pregnant women. There are no out-of-pocket costs, including copays, deductibles, for these covered preventive services. Additionally, as previously mentioned, if the screening is positive for alcohol misuse, the patient would qualify for up to 4 brief face-to-face counseling sessions annually as long as certain criteria are met, including counseling is provided in a primary care setting by a primary care physician or other primary care practitioner. Both RHCs and FQHCs fall within the classification of a primary care setting, and therefore a qualified primary care physician or other primary care practitioner can perform these services in these two settings. This includes any practitioner who meets the CMS definition of an RHC or FQHC practitioner. And for more information, please refer to MLN 006398, Information for Rural Health Clinics, MLN 006397, Federally Qualified Health Center, and the Medicare Claims Processing Manual, Chapter 18, Section 180. And those links are available on the resources slide at the end of the presentation. The HCPCS codes used for alcohol misuse screening and counseling are G0442 and G0443. G0442 is for annual alcohol misuse screening 5 to 15 minutes. G0443 is for brief face-to-face behavioral counseling for alcohol misuse and is reported per 15-minute session. Both codes are time-based services, meaning documentation must reflect the time spent providing the service. To qualify for billing, the documentation of the counseling must indicate that the service lasted at least half of the specified time threshold. When documenting the time spent on the service, include not only the actual minutes, but also what services were provided during that time period. Additional informational coding for the Alcohol Misuse Screening and Counseling can be found in the Medicare Claims Processing Manual, Chapter 18, Section 180. And before we wrap up this webinar, I want to address a pre-submitted question we received regarding billing. So the question asks, what's the minimum standard for billing G0442? If the patient is asked about alcohol use and reports they do not drink or do not drink excessively, can the provider still bill the service? And Medicare allows you to bill CPT code G0442 for an annual alcohol misuse screening, even if the patient reports little or no alcohol use. The key requirement for billing G0442 is that a validated alcohol screening tool, such as the audit tool, is administered and then documented in the medical record. If the patient's screening result is negative, meaning they don't misuse alcohol, a brief intervention is not indicated, and CPT code G0443 for brief behavioral counseling cannot be billed. However, performing and documenting the screening itself is sufficient to bill G0442. The purpose of the screening is to identify individuals at risk for alcohol-related problems. Therefore, Medicare covers it annually for all beneficiaries as part of preventive care, regardless of their current alcohol use. And let me just make sure that addressed your question, Diane. Okay, yes, that did. And I did get a question before we move on asking, does the patient have to consent to the screening? And the patient, you should be letting the patient know and asking if they want to have the screening. So do you need actual written consent? I do not believe you do need actual written consent, but I would document verbal consent that you're letting them know you're screening for that and give that patient an option to opt out of it should they want to. Then if they do opt out of the screening, they decide they don't want to consent for it, make sure you're documenting that it was provided or it was offered and that the patient has declined it for documentation reasons. Screening and counseling are essential for identifying, managing, and addressing alcohol misuse at an early stage, preventing its progression into alcohol dependence in patients. Medicare covers alcohol misuse screening and counseling as part of the preventive service benefits for Medicare Part B. Providing these services to your patient is crucial for detecting alcohol misuse and treating the issue before it can result in any potential health complications. So as a recap, during today's webinar, we reviewed background information on alcohol misuse, provided an overview of the Medicare preventive services of alcohol misuse screening and counseling, and discussed Medicare Part B coverage criteria for these preventive services. This slide contains links from the CMS website, including the Medicare Claims Processing Manual, Chapter 18, Section 180, MLN 006398, Information for Rural Health Clinics, and MLN 006397, Federally Qualified Health Center. Additionally, I've included links to the 42 CFR Section 410.78 B314 for more information on telehealth services, the WPS resource on alcohol misuse screening and counseling, and the encore presentation for the billing of alcohol misuse screening and counseling. Please use this slide as a reference when reviewing today's presentation. So we're now at the end of the formal presentation. Please remember, if you have any questions, please put those questions in the chat. And let's see, do I have any other questions? It does not look like I do. If you do have any other questions, just put them in the chat and we'll answer it before we wrap up. But let's move on to our final screens. Please take a moment to complete the survey and share your feedback. We'll use your feedback to develop topics for future education events. And you can access the survey by either clicking the link in the chat or by visiting the CMS Qualtrics page after the webinar. In a few minutes, you'll receive an email thanking you for attending, which includes your certificate of achievement and a link to the survey. If you need contact hours for continuing education, they'll also be in the email. If you don't see it, check your spam folder. If you called in, email us at wps.gha.education@wpsic.com with the webinar name and phone number, and we'll send you your certificate of achievement. If you think of any additional questions after today, you have 7 days from today to submit them. Send them to our education mailbox at wps.gha.education@wpsic.com and put the title of this webinar in the subject line. However, if you have claim-specific questions, please don't direct those questions to to us because we don't have access to your claim information and they're therefore unable to look up claims. Direct any claim-specific questions directly to customer service department. Also remember, we cannot accept any type of PHI or PII via email. And I don't see any other questions. Oh, I do. Where can we access the recording? The recording will be on YouTube, and I anticipate that recording being under our encore presentations within the next business days, probably by tomorrow. It also will be on our website, but that will probably take about 10 business days to have it on our website. So for the quickest way to get it is to go on YouTube, but it will be accessible on our website as well for several months. We usually keep about the past 90 days of recent webinars on our website. And that would be under, on our training center, under the Encore Presentations tab. And let me look to see if there's any other questions, and I do not see any others. So finally, on behalf of myself and all of Provider Outreach and Education, including Mary Sue, thank you for attending today's webinar on alcohol misuse screening and counseling. As a reminder, this presentation will be posted as an encore presentation on the Training Center page on our website. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us for future events. You may now disconnect.